Hi, I'm Bill Dobak, one of the maternal-fetal medicine specialists here at Tallahassee Memorial HealthCare. I tell them unequivocally they should. I know that it seems like the World Health Organization has been a little hesitant to make that, but make that recommendation. But all of my other maternal-fetal colleagues have strongly, unequivocally recommended for women during pregnancy to get the vaccine. There is no question that with pregnancy, you are at higher risk of developing the severe disease of COVID-19. And so without hesitation, I tell everyone to get the vaccine when they can. So why in pregnancy to recommend it is a great question. We know with respiratory infections during pregnancy, oftentimes the disease can be more severe than when someone's not pregnant. We see that every year with influenza. We have also seen that with COVID-19, where young healthy women do sometimes develop the more severe form of the disease, and it's oftentimes because they are pregnant. So we know pregnancy does increase your risk to developing the severe disease, and that is definitely not good for mom, definitely not good for baby. And so we have strongly recommended for pregnant women to get the vaccine as soon as they are able to get it. So the reason it hasn't been recommended is in the trials, they did not include pregnant women, as is oftentimes the case with trials. But as with anything, with the large enough study population, people do get pregnant during the study, and they had pregnant women in the trial, and there were no adverse outcomes, nothing to report that should alarm anyone. Now, since we've been rolling out the vaccine since the middle of December, we've had well over 20,000 pregnant women receive the vaccine with no reports of any adverse outcomes and no reports to change the recommendation to offer it to everyone who's pregnant.
Okay, great.
I have recommended whenever you're able to get the vaccine. With first trimester exposure, we know there's no association with miscarriage. The problem is, in the news, you'll hear someone gets the vaccine and then something bad might happen in 24 hours, which is unrelated to the vaccine. It just happens to coincide with that time. In the first trimester, unfortunately, miscarriage is not uncommon, but there is no association with miscarriage. So I have strongly encouraged patients that we see to get the vaccine as soon as they're able to get it. So the question of the association with the vaccine and infertility, there is no association with the vaccine and infertility. It was incorrectly stated that it would attack one of the spike proteins that's used to help attach the placenta to the uterus. That is incorrect. There is no association with infertility. I would remind them that many medical professionals are strongly, myself included, strongly advocating for women to get the vaccine when it's made available to them. All of the healthcare professionals that we have taken care of here, I have strongly encouraged them to get the vaccine as soon as they can, and all the literature and all the science currently says that it's safe. In fact, as of 2 days ago, well over 20,000 pregnant women have received the vaccine, and there have been no reports of any adverse outcomes or any problems. The other safety recommendations that we make is to follow the guidelines that have been in place since the start of the pandemic. We do recommend face masks, social distancing, frequent washing of the hands as well to help decrease the risk of developing the disease. The only thing that I'd like to communicate is to get the vaccine. I think it would help tremendously with their health, with their baby's health as well. We know that unfortunately, if you develop COVID-19 while pregnant and you develop some of the severe disease, then you are at higher risk for prematurity. Other horrible complications of pregnancy have been seen to increase with COVID-19 and pregnancy. And so my only advice is, when you're able to get the vaccine, to absolutely, without hesitation, get the vaccine.